President Cyril Ramaphosa will address the nation tonight amid the rising number of confirmed COVID-19 cases and resultant deaths. South Africa is now sitting at over 264,000 positive cases and almost 4,000 deaths, making it among the top 10 countries with the most coronavirus cases. Now there's talks about the country going back to the stricter level 5 lockdown. Joining us now for that discussion is Economist Azar Jammine. Thank you so much, Mr. Jammine, for joining us. You're live on eNCA. South Africa, after the first month, for instance, our CPI dropped by 3%, or rather 3% from 4.1%. And we've been, on lockdown for the past 3 months, going on to 4 months now. It looks like our economy is looking really bleak at the moment.
There's no doubt that the lockdowns and social distancing and what they have meant in terms of the closure of many businesses, especially small businesses, has been that people, a lot of them have been losing their jobs or getting a pay cut, and a lot of people have been spending a lot less, including myself, being at home. I've spent very little on petrol and on many other things that I would normally have spent on in eating out. And there's a knock-on effect from that. If there's less spending in the economy, more people lose their jobs, companies make lower profits, and, there's more despondency and despair. Not to mention the mental turmoil that many people are going through as a consequence of the effects of this.
Well, of course, we can't disagree that it's quite a difficult decision as a government to decide between health, people's lives, as well as the economy. Now, the last time the president, one of the last addresses that he gave to us, he said that, they'd decide whether there's some provinces that would probably go back to, for instance, a level 5 lockdown where the economy basically was shut. Do you think, that probably will happen? How that will affect us? Obviously, economically, it will be very difficult.
Now, the logic behind doing that is the fact that the virus is spreading at vastly different rates in different provinces. In the initial 2 months of the virus, it was the Western Cape that saw nearly 3/4 of all the cases. All of a sudden, in the last month, the Western Cape's growth in infections has slowed markedly to almost single-digit figures per week, whereas Gauteng and more recently now KwaZulu-Natal have seen a massive escalation and acceleration in the rate of infections. In Gauteng, the rate of infection has been doubling every 8.5 days. For the last 5 weeks, the weekly rate of growth has been between 70 and 80%. And as a consequence, that raises the question as to whether Gauteng should be shut down and the KZN should be shut down as compared with other provinces. But from their own analysis, the government has apparently concluded that that is not called for, and that instead there should be more intelligent kinds and more specifically directed interventions to try and stop the spread of the virus. There's no doubt that the virus is spreading more rapidly in South Africa than in most other countries at present. I think the only countries ahead of us are the United States with about 60,000 per day, Brazil with 40,000 a day, India with 25,000 a day, and more recently we've been spreading the virus at around 10 to 15,000 per day. So given that our population is so much smaller than all those other countries, you ask yourself what is going wrong in South Africa. So it is very serious. On the plus side, the rate of people who are actually dying out of those who are being infected is extremely low by international standards. And there again, one must ask what is happening. Are we just testing more avidly and in a more focused way in South Africa? I'd like to think that that is the reason, and that we therefore have had our health facilities more readily in place to be able to cope with it. But then against that, we've got the whole problem of alcohol and the way in which injuries and deaths and illnesses and attacks and violence through alcohol and car accidents are resulting in many spaces in our hospitals that would normally have been devoted to trying to keep up with the COVID-19 virus are now having to be redirected towards trying to sort out problems generated by the spread of alcohol.
Well, thank you very much, Mr. Jammine. That is Economist Azar Jammine coming to us from his home.